Welcome to our first module and the first lesson in this program. Before we can fix the rotator cuff, we need to understand what it actually is. Having a clear understanding of the rotator cuff is essential if we want to properly address shoulder pain, limited range of motion, and feelings of weakness. Once you understand what's going on inside your shoulder, the rest of this program will make a lot more sense. So let's start with the basics. What is the rotator cuff? The rotator cuff is made up of 4 muscles that surround the shoulder joint. These muscles are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Together, these muscles work as a team to stabilize the shoulder and control movement of the arm. The tendons of these muscles form a cuff around the head of the humerus, your arm bone, helping keep it centered in the shoulder socket while still allowing a large amount of motion. 2 of these muscles are injured more often than the others, the supraspinatus and the infraspinatus. You'll hear those names come up frequently throughout this course. Let's start talking about common rotator cuff injuries. Rotator cuff injuries can happen in a few different ways, and today we're going to cover the most common ones. These include tendonitis, partial tears, full thickness tears, and shoulder impingement. Let's break each of these down one at a time. Let's start talking about rotator cuff tears, full versus partial. A rotator cuff tear involves damage to the tendon, the tissue that connects the muscle to the bone. A full thickness tear means the tendon has completely torn off the bone. If this is the case, it's very important that you're evaluated by an orthopedic specialist. Physical therapy cannot reattach a tendon that is no longer connected. If you suspect a full tear or you've already been told you have one, I recommend pausing here and scheduling an appointment with an orthopedist before continuing. A partial tear, on the other hand, means only part of the tendon is damaged. These can often be managed very successfully with physical therapy, depending on the severity. There's one important concept that I do want you to understand. A partially torn tendon does not grow back to the bone. However, physical therapy can significantly reduce pain, improve strength, and restore function, even when a partial tear is present. Now let's discuss rotator cuff tendonitis. Another very common issue is rotator cuff tendonitis, which is inflammation of the rotator cuff tendons. Tendonitis is almost always an overuse-related condition. Common symptoms of this include pain with overhead or rotational movements, general shoulder soreness or tenderness, and difficulty sleeping on the affected side. Here's an important concept to understand. Tendonitis is often the warning sign before a tear. It's your body's way of telling you that the shoulder is overloaded and needs attention. Many people feel this pain, ignore it, push through it, or simply learn to live with it. Unfortunately, orthopedic conditions are often progressive, meaning they can worsen over time if not addressed. This is commonly how partial tears develop. If you know you've been dealing with rotator cuff tendonitis, continuing through this program or seeking in-person care can help prevent things from progressing further. Now let's talk about shoulder impingement. This is the last condition we'll talk about today. This usually involves the supraspinatus tendon, or the muscle that does this. Sometimes it can involve the infraspinatus tendon as well. When the rotator cuff muscles are weak or not properly functioning, the humerus, or the arm bone, can migrate upwards. When that happens, the rotator cuff tendons can get pinched between the arm bone and a structure called the acromion, which is part of the shoulder blade. That pinching is what we call impingement. The long-term solution for impingement is strengthening of the rotator cuff. Stronger rotator cuff muscles help pull the arm bone back down, creating more space and reducing irritation to the tendons. We just covered a lot of information. Now that you understand what the rotator cuff is and the most common ways it gets injured, the next step is to talk about clinical pearls and what not to do so we can avoid setbacks and flare-ups before starting the road to recovery.